It is absolutely not uncommon for women with PCOS to not have their periods for many months at a time. But the thing is that there are a lot of things that you can do to bring your AWOL period back. So that's exactly what we're going to be speaking about in this video. I'm Taryn from PCOS Diet Support, and as always, I'd love to encourage you to subscribe, hit the notifications bells to get more videos just like this on how you can manage your PCOS from a really natural point of view. Now, when we're thinking about your period going AWOL, we first need to work out why that is happening. So what are the reasons that your periods go AWOL? Well, we know that an irregular menstrual cycle is one of the hallmark symptoms of PCOS. It is very much part and parcel of the syndrome that is PCOS. I must just give a caveat that not all women with PCOS have an irregular menstrual cycle. So you can still have PCOS even if your menstrual cycle shows up like clockwork every single month, okay? But there are many, many, many of us who do struggle with this irregular menstrual cycle. And that can really wreak havoc if you're trying to conceive. The goal for us, if we are in our reproductive years, if we have not reached menopause yet, our goal is that we should be having a period every month. So with PCOS, there are a number of reasons that our period goes AWOL. One of the reasons is that androgens, high testosterone or high androgen levels have been shown to disrupt the development of the egg from the ovary. Okay, so if we're not getting our eggs being developed to maturity and if we're not getting ovulation, then chances are we are not going to have a period. So that is one of the main reasons. Another thing that we need to think about is that women with PCOS tend to be insulin resistant. And the problem with insulin resistance is that it causes our ovaries to produce a lot of testosterone, which again is going to disrupt the menstrual cycle. So there are a number of things that are coming into play. The other thing is that women with PCOS have what we call high levels of luteinizing hormone. Now, normally we get the spike of luteinizing hormone just before we ovulate. But with women with PCOS, luteinizing hormone is high most of the time. So we're not getting this spike, which is not signaling to the ovary to release an egg. So there are a number of reasons. Now, we can tackle our absent periods from a number of different approaches. So we're going to take a really holistic approach at how to encourage our cycle to come back naturally. So let's have a look at some of the things we can do. Firstly, I want to encourage you to exercise wisely. We know that women with PCOS really benefit from doing exercise. It really helps to make your body more sensitive to insulin. It really helps to manage a lot of the symptoms and features of PCOS. But there is a warning with this, is that over-exercising, so exercising at high intensity for more than 60 minutes every day, is more likely to cause your periods to stay absent. Or if you do have a regular cycle and then you over-exercise, it could cause your periods to disappear, okay? So yes, absolutely exercise. It's so crucial to our PCOS management, but don't overdo it. Don't do it to the extreme. Don't over-exercise because that is going to cause damage to your hormones and it is going to cause your period to not come back. Number 2, lose weight. Now, I don't say this lightly, and I know how incredibly frustrating it is when you go to your doctor and your doctor says to you, just lose weight and you'll be fine. Your PCOS will get better. But nobody actually goes about telling you how to lose weight. And I understand the incredible frustration of that. And I have worked with thousands of women. Thousands of women have been through my PCOS weight loss program. And so I speak about weight loss in depth, and I know the struggle to lose weight. Now, it's not impossible to lose weight with PCOS, but I do understand that it can be very difficult. So I don't say this tongue in cheek, I don't say it lightly, but I am sharing what the research shows. The research shows even using 1 to 2% of your body weight, if you do have a high BMI, if you are overweight, just losing 1 to 2% of your body weight can help to kickstart your menstrual cycle. And I guess the benefit of putting in place a lot of the things that we're speaking about will not only help you to lose weight, but will also help you to really address the underlying PCOS hormones. So I'm not totally focused on calories. I'm not totally focused on weight loss, but I am about being the healthiest possible versions of ourselves with PCOS. And the research does show that losing just a small percentage of your body weight can help to to stimulate your menstrual cycle. The next tip is to use a combined approach. Now, I feel really strongly about this. I feel that there are so many layers to PCOS, and there are so many different areas that we could be working towards with our PCOS. And sometimes we tend to have this all or nothing approach where we go all out on the way that we're eating, but we are not exercising, or we go all out on taking our supplements, but we're not doing a lot of other things. Now, it's very easy to get burnt out with all these different ways that we could be managing our PCOS. So my suggestion is that we do small action in a number of areas to see benefits with our PCOS. Now, what I mean by that is taking a supplement is it's a quick win. It doesn't take a huge amount of effort. It's not like you have to change the entire way that you eat. It's not like you're going to the gym. It's a quick win. So take supplements and then start looking at asking yourself, how can I make my the foods that I eat just 1% better? How can I do a little bit better than yesterday on the way that I'm eating? How can I make slightly healthier food choices for my PCOS? And then maybe you feel like going to the gym for an hour is just too much of an ask. Well, that's okay. If you can go for a walk around the block, then do that. But by taking small steps in a number of different areas, you will see progress toward your PCOS, and you will start to see improvements in a lot of your symptoms, including getting your period back. So don't just focus on food and don't just focus on supplements. By taking a combined approach, doing a number of these things will really help with your PCOS. And again, it doesn't need to be these giant leaps and strides forwards, but small action consistently is going to get you results with your PCOS. Even if you feel like you're not doing a lot, it is going to help. Okay, the next thing is to consider acupuncture. Now, when I first started researching acupuncture, I'm very much about knowing the science behind something, knowing that what I am recommending has some kind of research and basis behind it. Now, I was very unsure when I started looking at acupuncture, but I was really pleasantly surprised to see that there are a lot of scientific evidence-based research to say that acupuncture can be helpful for women with PCOS. Not only can it be helpful, but it can be helpful in kickstarting your period. So if you have PCOS and you haven't considered acupuncture, then it really might be something that you would like to consider. Okay, the next thing is to be patient. Now, patience is not always my best virtue. It's something that I often have to work towards. But it does take at least 3 months to start seeing an improvement. The reason being is that it takes 3 months for an egg to reach maturity in your ovary. Okay, so maybe you'll see results really quickly, but chances are that this is going to be a little bit of a longer term approach. So if you're trying something and you don't see results within the first kind of week, 2 weeks, just be patient and trust your body that you are doing the things that you need to do to balance those hormones and to kickstart your period. Next thing is to change the way you eat. Now, I have done loads of videos on change the way you eat, and I'm going to link to one of my most important videos, which is the 3 pillars of managing PCOS naturally, and it goes into a lot of detail as to how to change the way that you eat and how that impacts on your PCOS and your hormone profile. But the bottom line is that how you eat impacts on your insulin levels. Your insulin levels impact on your testosterone, okay? Because our ovaries produce testosterone and they are very sensitive to insulin. So the more insulin you have, chances are the more testosterone you have. And remember, right in the beginning, we said one of the main reasons that our period goes AWOL is because of high testosterone levels. So one of the ways that you can manage your testosterone is to change the way that you eat. And then the next thing that we really need to look at, and again, this is something that I talk quite a lot about, is supplements for PCOS. Now, there are 2 specific supplements. Again, I mention them a lot. The first one is inositol. If you haven't seen the video on the benefits of inositol for PCOS, I'm going to link to it up here. I really want to encourage you to go and watch that video. There are some wonderful benefits, including kickstarting your period, okay, so and regulating your menstrual cycle. So if you're not taking inositol, then I really want to encourage you to go and watch that video. The next vitamin is vitamin D. 85% of women with PCOS are deficient in vitamin D. And it was shown that taking a vitamin D supplement can help to regulate your menstrual cycle and can help to bring back your absent menstrual cycle. So those are my tips for bringing back your absent menstrual cycle. It is so important that we do have a period. The thing is that with PCOS, the lining of the uterus can really build up, and it's important that lining is sloughed away on a regular basis, because there are some secondary risk factors. So if you have tried these strategies and your period has still been missing for a really long time, then I really do want to encourage you to go and see your doctor. There are some other medications that can be prescribed to bring on a period. It is something that's really important. So do consider that. Thank you so much for joining me, and I look forward to seeing you in the next video.